Hi everybody, this is a video about therapies that can be used to help regulate the autonomic nervous system. Somebody posted this question on one of my other videos. I had mentioned in my newsletter about this therapy we work with called, or this kind of collection of therapies that we work with that we call regulation therapy for the autonomic nervous system, or we use the acronym RTANS because that's a big mouthful. And so I am happy to talk about that because the question was, can I talk more about that? So sure, absolutely. Just before I jump into this, as per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only, and if you need medical advice, please talk to your healthcare provider to get that advice. So the autonomic nervous system is incredibly important, especially in the realm of complex chronic illness. Basically, the various stressors that lead to the complex chronic illness can really do a number on the autonomic nervous system. The autonomic nervous system is the branch of our nervous system that controls everything behind the scenes that we take for granted, like hunger, thirst, heart rate, breathing rate, temperature regulation, pain perception, hormone excretion, etc., etc., etc. And so it can really get discombobulated when the body is, going through chronic infections and mold toxicity and methylation issues and heavy metals and the whole nine yards. So one of the things that can be really helpful is working with therapies that help to better regulate the autonomic nervous system to help it kind of be in better balance, because it's kind of like the autonomic nervous system is the managerial system of the body. And just like if there's, an office building and the manager is just, a big stress ball and kind of running amok all over the place because all the departments are just, one's on fire and one's flooded and one doesn't have any supplies and there's just like running around like a headless chicken. You can imagine that manager is not going to do a great job managing everybody. So even if the building is falling apart at the seams, if you have a level-headed manager, they're going to be able to better coordinate the efforts to get things back on track again. So similarly, you want your autonomic nervous system to have a level head so it can get things back on track more efficiently. Thankfully, there are lots of great therapies that can be used at home, and there's not that all of these work well for everyone, but some folks do really well with amygdala retraining as a form of autonomic nervous system support. Some people do well with tapping therapy. Some people do well with, oh my goodness, what's the with vagus nerve stimulation. You can get little vagus nerve stimulating devices. It's a whole bunch of different at-home techniques that can be used, which is great. The regulation therapy for the autonomic nervous system, also known as RTANS, that we use at our clinic is something where we're bringing in treatments that folks generally can't access themselves at home, or at least not easily, because it requires certain treatment devices and skills to administer the treatment. So when we have patients where they just really need to, help support their autonomic nervous system very, as quickly and efficiently as possible, or patients who are just, find that they're running, they're really busy, they're feeling better, but they want to just kind of maintain the health benefits that they see from the autonomic nervous system support. This is why we offer this treatment. So the nuts and bolts of it. Seeing the time going up here, so I'll give the quick answer here, and if anybody needs more details, I can make a longer video or another video about this later. But the idea with the RTANs is to start by treating the nervous system on a very deep level and then move all the way up to a more superficial level. So the first part of the treatment involves having an acupuncture treatment, so a constitutionally based acupuncture treatment based on what's going on with the patient, while they're receiving pulsed electromagnetic field therapy, also known as PEMF therapy. The acupuncture needles are inserted acupuncture points, and it's been established, to my knowledge, that acupuncture points are areas of high density of autonomic nervous system fibers. So the acupuncture needle is literally penetrating down into the layer where the autonomic nervous system fibers are more dense, and it's actually mechanically stimulating those fibers. When we have the PEMF machine going at the same time, those pulsed electromagnetic frequencies have anti-inflammatory effects, tissue healing effects, nervous system regulating effects that help to synergize the effects of the acupuncture. So it's a very deep level of treating the autonomic nervous system. And indeed, a lot of folks, when they get off the treatment table, they're like, whoa, I'm just about ready to go take a nap. But we want to send patients out into the world feeling better. So the next step is we work on stimulating all the major joints in the body. We use a device called an arthrostim. I'll maybe do another video sometime where I show a little demonstration of this, but it's basically this motorized adjusting tool that's used to basically very gently yet perceptibly stimulate the various joints of the body. So it kind of looks like a little motorized hand drill basically, but instead of having a drill bit on the end, it's got a little rubber stopper at the end of a sort of a prong, and so it stimulates all the major joints of the body by kind of this like vibratory motion back and forth, like I'm trying to mimic with my hand there. So we do that over all the vertebral joints, the shoulders, the knees, the costosternal junctions, the SI joints, hips, if I didn't say that already, ankles, all the major joints in the body. And by doing that, all of our joints are innervated by our autonomic nervous system. And by stimulating those joints, it can help to better regulate the autonomic nervous system. That's one of the reasons, to my understanding, why chiropractic adjustments have been shown to help with lots of things beyond just back pain. They can help to boost up immune system function. They can sometimes help with ear infections, like things you think, how the heck could that possibly happen? Well, to my understanding, it's largely mediated through the autonomic nervous system. So after those treatments, which feel really quite good, I've had my own joint stimulated a number of times by an arthrostim, and it is quite a nice experience. So you kind of get off the table from the acupuncture and the PEMF, you're kind of a little bit like, okay, I'm about ready for a nap. I feel like very, very zen. Well, now I've had my joint stimulated. Okay, I'm feeling a little bit perkier. And then the last part of the treatment involves using our red light, infrared light panel. There's several good ones out there on the market. The one we use is called the BioLight. We have no financial affiliation with them. I just like their product. I think they have great customer service, and we've been really happy with our BioLight from them. And basically, it's this 5 foot by 2 foot or so panel that shines on the patient's entire body. So they stand in front of the light, just basically down to underwear in a private room, obviously, and standing about 6 feet away from the light, and then they just let it shine on their front for about 10 minutes, and then let it shine on their back for 10 minutes. And so the red and infrared light is able to penetrate deeply enough to hit the subcutaneous tissue of the body, and in the subcutaneous tissue, so i.e. the layer of fat that's just below our skin, we have lots and lots of these autonomic nervous system fibers. And so the BioLight is literally treating all of those subcutaneous nervous system fibers in the body. So it's a very comprehensive yet very superficial way of stimulating / treating the autonomic nervous system. And so a lot of folks, when they finish their BioLight, they feel good. They feel kind of recharged. They feel a boost of energy. And so you kind of go from the very, very deep Zen state from the acupuncture PEMF treatment to feeling a bit perkier from the arthrostims, like, oh, that feels good. I'm kind of coming back to the world, and then kind of can go off and take on the world more effectively post BioLight treatment with the red and infrared light. And the red and infrared light have anti-inflammatory effects, tissue healing effects, mitochondrial stimulating effects. They help to improve microcirculation. So a number of beneficial effects on the body in general, and in particular on the autonomic nervous system. So folks who have been getting these treatments done, they typically report feeling more relaxed. They feel calmer. If they have dysautonomia symptoms, like where there's certain parts of their nervous system that are just kind of running amok and sort of acting all wild and crazy, those symptoms can help be more settled down. So it has a really nice balancing effect, if you will, on the autonomic nervous system. So thank you for the question. Sorry for the long video, folks. Hard to get that into less than 8 minutes, apparently. But if anybody has any questions about this or anything else, just post in the comment section below, and I will answer as soon as I can.